The client is exhibiting symptoms of myxedema. The nursing assessment should reveal 1. Increased pulse rate. 2. Decreased temperature. 3. Fine tremors. 4. Increased radioactive iodine uptake level. Let's go over this question together. Step 1. Read the question carefully. Look for any key words. Step 2. Reword the question in your own words. Step 3. Understand what it is asking. It is asking what is a symptom of myxedema. If you have the basic knowledge and memory of myxedema, you should be able to get this correct. Step 4. Read each answer carefully. Step 5. Eliminate at least 2 wrong answers. Step 6. Reread and compare your last 2 answers. Which answer is the best answer? Step 7. Make a decision. Now let's see if you got the answer correct. The correct answer is 2. Decreased temperature. Myxedema is a term generally used to denote severe hypothyroidism. Myxedema is also used to describe the dermatologic changes that occur in hypothyroidism and occasionally hyperthyroidism. Simply, symptoms will be slow and low. If you want to practice more test-taking strategies for your NCLEX exam, then click on the link below in the description. You'll land on a page where you can enter your details to get instant access to a free online test bank. Consistently practicing test-taking techniques is one of the best ways to pass the NCLEX on your first try. It's time to become a registered nurse. Click on the link below now.